What is the relationship between vitamin D blood levels and COVID-19 infection, severity of the disease, and mortality? These are some of the questions we are going to try to answer in this series of videos. If you have not seen the previous videos yet, I invite you to go and have a look. I have published several videos now over the past week or so, and I'm going to put a description, the link below. Go and check them out. There's a lot of very useful information for people who are interested in vitamin D blood levels, COVID-19 infection, and other infections as well, but also in understanding a bit better what is the relationship between all of these parameters and what is the importance of vitamin D on the immune system and in protecting you against possible infections and severe outcomes if you're already infected. So let's have a look at what this new paper tells us. This is a review published about a year ago, and in this review they looked at a large number of odds. As you can see here, they looked at 318 published papers, and then they selected, out of these 318 papers, they selected 14 based on several criteria, which were mainly relevance to the questions they were trying to answer, but also quality of the published data. And as I am going to show you here, the results are very interesting, and there's a lot of studies now that indicate that vitamin D deficient individuals are at a higher risk of COVID-19 infection compared to vitamin D sufficient patients. Moreover, in these studies, they found out that individuals with vitamin D deficiency were 80% more likely to acquire COVID-19 infection. Okay, which is very, very significant, 80% more likely. And they concluded that a low serum 25-OHD vitamin D level, which is the circulating form of vitamin D in the blood, was significantly associated with a higher risk of COVID-19 infection. Let's have a look in more detail at some of the results of this study. They even show a figure here of how they assessed the papers and how they selected publications in this study. So as you can see, they had a large number, over 300 of records initially, and then they screened them and selected 14 of them for eligibility in the qualitative synthesis, and then they did a quantitative synthesis with 8 papers. In this table, you can see the references of all the 14 papers that were included in this study. So let's have a look at some of the main results of these different studies. In the first one, from the United States, and this is a study that included nearly 500 patients, okay, so relatively significant number. One of their main conclusions was that vitamin D deficient patients are at a higher risk of COVID-19 infection as compared to vitamin D sufficient. And this result has been now verified and corroborated by several other studies. I mean, a large number of other studies, okay? And several of them are included in this review. One here from Indonesia with 780 patients. And they write here that death was approximately 10 times more likely for vitamin D deficient cases. In this other study from Israel with a large number now, 10 times more patients actually, 7,807 patients. Mean vitamin D level was significantly lower in COVID-19 patients than control. So again, this confirms what we just said before. Now there is one study which is going the other way from England, and I looked at this study and well, I'm not quite sure exactly the reason why. They did have a fairly high number, 449 patients. They did look at a large number of factors, including ethnicity, age, etc. What they found is that there was not a potential link between vitamin D concentration and the risk of COVID-19 infection. So this is the only study here which has been included, which does not support what the other studies found, which is that there is a relationship between vitamin D levels and COVID-19 infection and severity of the disease. In this other study from Switzerland, 187 patients, significantly lower 25-OHD levels were found in COVID-19 patients compared to the control group. This is a result, again, which supports the conclusion of many other studies. Another study from Iran here, the level of serum 25-OHD was significantly lower in COVID-19 positive patients. Another study from China with a relatively low number of patients, 142, significantly higher rates of vitamin D deficiency were found in COVID-19 patients, 42% versus 11% in the control group. Okay, so that's a large difference here. Another study from Spain with nearly 400 patients. COVID-19 positive patients had a lower vitamin D levels than the control group. Moreover, 25-OHD levels are lower in hospitalized COVID-19 patients than controls. This corroborates also what another very large study this time, nearly 80,000 patients, a study from the United States, as you can see here. In these studies, they found that SARS-CoV-2 positivity is strongly and inversely associated with circulating 25-OHD levels. Okay, and they even had that this relationship persists across latitudes, races, ethnicities, sexes, and age ranges. So this is an important study with a large number of patients, and if you're interested, I could do a review of this one as well. Let me know in the comments below what you think. If you want to see a more detailed review of this study, let me know in the comments and I can make it happen if there are enough people interested, okay? And here is another study from Iran where they found that there was a significant association between vitamin D sufficiency and reduction in clinical severity and mortality. So there is quite a bit of evidence now, many different studies from many different groups all over the world, really pointing to the fact that a low vitamin D status is associated with more patients, more people catching COVID-19, being hospitalized, having more severe outcomes, including mortality, and that people who have a sufficient level, higher level of vitamin D in their blood typically are less associated with COVID-19 infection and COVID-19 hospitalization. As a conclusion of these studies, they found that a lower 25-OHD level increased the risk of susceptibility to COVID-19. They also write here that a study from Belgium revealed that vitamin D deficiency is a prevalent risk factor for severe COVID-19 infection. 25-OHD levels above 30 nanograms per milliliter, which is considered sufficient, were associated with a significant decrease in the severity of clinical outcomes. So here is a number, 30 nanograms per milliliter, which is usually considered sufficient level of vitamin D in the blood in the 25-OHD form. And remember that sufficient does not mean optimal, okay? Sufficient means it's just sufficient, that's what it is, just the bare minimum. And it is oftentimes recommended to even have higher levels of vitamin D in your blood. Vitamin D is a very safe vitamin. You can have much higher levels, you can have 50, 60 nanograms per milliliter without any problem. In fact, my own level of vitamin D in the blood, last time I checked, was close to 60 nanograms per milliliter. Let me know if you have measured your own vitamin D blood level as well. That would be very interesting, and what were the results. And tell us also your age and how much sun exposure you get all year long, where you live in the world. Do you live in the northern hemisphere, in the southern hemisphere? Do you live close to the equator? Let us know all of this, because this is very important in order to know how much vitamin D you get. Also, if you take vitamin D supplements, let us know how much you take. This is quite important because my own experience and the experience of many other doctors actually shows that it is not so easy to increase your vitamin D blood levels. There are many different ways to do it, and I would be very interested to start a discussion on this. So let us know in the comments what is your experience with vitamin D supplementation, vitamin D synthesis from sun exposure, and also measuring your vitamin D blood level. Thanks a lot for watching this video, for commenting, for liking and subscribing to the channel. And also don't forget to check out the other videos if you have not done so yet. Also, I wanted to mention that you can find a lot more very, very useful and interesting information on the stanbridgescientific.com website, where I will be adding more and more information and videos also every week. So go and have a look. I will also be adding videos and data on vaccine side effects and mortality due to COVID-19 vaccines, which, as you know, cannot be discussed on YouTube. And so I decided to just put this information regularly on the stanbridgescientific.com website under the COVID-19 tab. So go and have a look if you have not seen it yet. And you can also add your comments directly there, okay? So we can also start a discussion on this website as well. And also you can go to Rumble, where you can find several videos in the Stanbridge channel. So thanks a lot again for checking these videos and for liking them, and I will see you in the next video.